The Foundation for a Healthy Kentucky set out with a vision to address the unmet healthcare needs of Kentuckians, to empower an army of advocates across the state, to bring together bright minds to build sound and solid health policy, a vision to create a foundation for the people.
The Foundation for a Healthy Kentucky is committed to addressing the unmet healthcare needs of Kentuckians. We do this by investing in communities and informing health policy with grant-making, training, and technical assistance.
Dr. Bose was the former vice president of the University of Kentucky Medical Center for Policy and Program Planning. He was a nationally known health economist, and he counseled us from the very beginning. He said, you must focus on health policy.
In that first year, we went out and talked to people in Kentucky. We did forums all around the state, and we asked people, you know, if you were king or queen for a day, what would you like to see us address? And it was interesting that people were very focused on youth, very focused on children, nutrition, physical exercise, so forth, on youth to stop the smoking and the substance abuse. And then there was that kind of global picture of what do we do about people that don't have access to care at all?
I think a strength of the Foundation for a Healthy Kentucky is the people who make up the board and the Community Advisory Committee, and certainly the staff and the leadership of the foundation. There are some very competent and informed people. They're from various disciplines around the state. And so I think it's just a big plus that you have those types of people interested in the health care of their fellow citizens.
The Foundation for a Healthy Kentucky invests in communities, investments to encourage better health for people, to create good health with people, to bring essential health care services to people, investments in communities to make a difference in the lives of Kentuckians.
Although the more than $18 million that we've been able to invest in improving the health of Kentuckians may seem like a lot, there's so much more that can be done. And that's why it's always been our policy to try and leverage those resources in a variety of ways. We also have a history of rapidly responding to matching grant opportunities, whether it's helping the Cabinet for Health and Family Services take advantage of federal funding opportunities, or helping nonprofits around the Commonwealth attract funding from national funders who require a local match.
In fact, when we were funded, there were only 7 communities in Kentucky that were smoke-free, and only 2 of those 7 had comprehensive laws, meaning that everywhere, every day that people went to work, they were protected, and that was less than 1% of Kentucky's population protected. And today, we are at 34% of our population covered. We've gone from 7 communities to 31 communities that are smoke-free, so we couldn't have done that.
The grant funds afforded us for our oral health outreach program have, for the first year, provided an opportunity for over 1,200 children to receive oral health services in their schools. The opportunity for our communities to have access for the investment of foundation funds will long outlive my tenure or the staff of Barren River District Health Department. The description that we use for our oral health project is called Saving the Teeth of a Generation. And we actually believe that we can make a difference in partnership with the foundation.
We received a Phase 1 planning grant that got us started as a community health center. We started off as 1 clinic. Today we're 5 clinics. Today we are in 5 different counties. We serve our 10 counties with our 5 different clinics. We have over 15 providers. We're seeing 70,000 encounters a year, and we're providing a vast array of services.
The Foundation for a Healthy Kentucky informs health policy, information that is supported with evidence-based research that never loses sight of the people who need care, that is tailored to issues that impact Kentuckians, information that arms people with a vision and a passion for change.
In addition to the grant making we do and the data that we try to get into people's hands, one of the important functions of the foundation is convening decision makers and informing the field through annual sessions like the Coordinated School Health Institute and the Howard Boast Health Policy Forum, where again we highlight important issues of the day and bring together leaders from Kentucky and around the nation to get the latest and best information on these issues.
One of the things that the foundation has done well is to support advocacy. They've had an advocacy initiative which has supported 8, 10, 12 organizations in Kentucky, and they're not all the same.
Kentucky Voices for Health is an organization of over 250 organizations and individuals working together to improve the health of Kentuckians. And the foundation has served as our fiscal agent. Without them, it would not have been possible for us to attain a Public Welfare Foundation grant that sustained our efforts to build and develop this coalition, and also to look at health reform efforts and to look at access initiatives.
The bank of information that's available through the foundation, the data collection, their ability to endow the 2 chairs at U of L and UK to be available to provide research, for instance, none of that would have been possible without, obviously, the strong work of Attorney General Ben Chandler and the court system, but certainly without the vision and the existence of the Foundation for a Healthy Kentucky, we would be a much unhealthier place.
Communities would not have the data that they needed to make informed decision. It's one thing to make a gut decision, oh, my community needs this or my community needs that. It's another to actually have the facts to use with policymakers to say the individuals in my community believe this, the individuals in my community experience this or do not have access to that. And the foundation has been able to give that armament to communities.
The Foundation for a Healthy Kentucky is approaching a new day to address the healthcare needs of children, to share and build on 10 years of success, to continue to listen to and to learn from Kentuckians, a new day to promise better health for the next generation of Kentuckians.
If we didn't have the foundation to support this what we call an army of advocates, creating a situation where people are trained and supported and they know they're doing what is effective to help their fellow man, I think we would not be as far along.
That when we went into these school systems, that 40% of the kids had never seen a dentist, that a lot of our students were telling us they didn't even own a toothbrush, then that's a huge impact, not just today, but carry that forward. You get those kids 10 years from now, they have more permanent teeth. More permanent teeth lead to a healthier child. A healthier child leads to a child that's able to gain a higher educational status, which will lead to a better job, which will lead to improvement of Kentucky's economy down the road.
In the next 5 years, the foundation will move to a broader and a stronger role in informing public policy. We will build on some of our successes, such as our data collection, such as our research, such as the publications that we have to inform policymakers and to enable advocates to have the kind of data and information and skills they need to inform public policy and to shape public policy.
If the foundation did not have the vision that it has and have the commitment from not only its board but its community councils from all around the state, there would be a huge gap. There would be a gap in 2 areas. There would be a gap in access to health services, not only in Barren River District, but in other communities across the state. But then there would also be a gap in awareness and education of health professionals about the importance of policy change. I think those are 2 important things that the foundation can feel extremely good about.